Hello, so today we are going to demonstrate another practical session which is erythrocyte sedimentation rate or ESR. So ESR is a type of blood test that measures how quickly the red blood cell or erythrocyte settle down at the bottom of a test tube that contains blood sample. Normally, red blood cells settle relatively slowly. A faster than normal may indicate inflammation in the body. Before we proceed with our procedure, we have to make sure that our apparatus is complete and ready. So here we have patient sample inside EDTA tube, ESR tube that contains anticoagulant which is sodium citrate, Western green tube, plastic pasture pipette, and ESR tube rack.
And now it's time to perform the erythrocyte sedimentation rate procedure. First, you must make sure your sample is well mixed by gently invert 5 to 10 times. Then, transfer your sample to the ESR tube with your plastic pasture pipette. Gently tap and invert your tube, ESR tube, to make sure the sample is well mixed with the anticoagulants. Place your Western green tube on the top of your ESR tube and gently press until you hear a click sound. Then push slowly until your sample reach the top part of the Western green tube. Leave your sample to rest for 1 hour.
So after 1 hour, we are now ready to read our ESR result. For your information, the normal range for ESR test is anything that below 20 mm per hour. So here we have prepared two samples. So the first one showing a normal result with reading of 10 mm per hour. And the second sample showing more higher reading, which is 65 mm per hour. Normally, red blood cells settle relatively slowly, which is below 20 mm per hour. Anything faster than that may indicate inflammation in the body.